30, 40 and definitely after 50 we get mammograms done, and that too at a regular interval of time.
And what should be the interval?
That regular interval could be anywhere between 8 months to 12 months. 12 months or more is also fine if it is clear on the first time. And then slowly you can increase the gap also, but you have to get it done, right? Just to be sure, right? It is always that it's better to detect early and to be sure rather than to detect at a later stages, right? Also, another thing is, if you have family history, not only on your mother's side, at your father's side also, and also not only, there are certain types of cancers in males also. So not only breast cancers, any form of cancer, if you have a family history, then you have to be double sure about it, right? Why? Because there are certain types of genes which predominate, that is BRCA1 and BRCA2 genes, which usually predominate these conditions. Now, of course, you are not going to go for a gene typing, but you will get to know and have an idea about it if you have this in your family history, right? Now, coming forward towards what would be the risk factors. So basically, there will be two types of risk factors. One kind of risk factors which we can control, and another kind of risk factors which we cannot control. It's just there, it's not in our hands. So the risk factors which we cannot control would be, of course, to have BRCA1 and BRCA2 type of genes, that is in heredity, right? The second type of risk factor would be to start when the menses start earlier than age of 12 or menopause starts later than age of 50. If nowadays, girls especially, they have early menstruation. And that is again it has a very big impact from lifestyle. Kids are now subjected to all the other social media, such food, such environment. They grow and mature very fast, and that is also one of the reasons that they get menstruation early. Now, this is something in our hand which we can control for the kids. Then comes hormone replacement therapies. Some females, they would like to push their menopause even further because of A, aesthetic values, B, maybe they have started the family planning late and then they still want to try. So in those conditions, if you go for a hormonal replacement therapies, then you are supplementing your body from a foreign or in supplementary hormones, which can go and lead to hormonal imbalance. So that is something which we can control. But to push the menopause only because of these reasons is not advisable. Yes, if your doctor advises you for hormones because you have complications related to menopause, then it is valid. But just because of these reasons, it's not a choice. It should never be a choice. This is a normal natural cycle. As you started naturally with your menstruation, it is going to end at some point. So try not to fight it and accept it. Yes, we should always prepare our body to have a natural and complication-free menopause. But there is no point going for a hormonal replacement therapies because it will increase the risk of cancers, be it breast cancer or any other form.
But how do we prepare our bodies for that? You said we should prepare our bodies, like we're all 40 plus, right?
Yes.
So we are somewhere or the other, we are going towards that notion. So what is the preparation that a body needs? Should we have some hormones, multivitamins? Should we consult a gynec? How should we go about it?
So first of all is, of course, every time when you go for a multivitamin or any form of supplements other than food, you should always consult your doctor. Why? Because sometimes what happens is we just start popping pills, supplementary pills of calcium, vitamin D, collagen, vitamin C, which may not be even necessary for your body. Because what happens is, it is always better that we get ourselves checked thoroughly regarding what all vitamins are lacking inside our body and what all vitamins are in a proper amount. Anything in excess can give rise to some or the other complications. So definitely whenever you are trying to go for a supplement, consult your doctor first, get a proper test done, then only you have to go for any form of supplements. One thing would be that. Another thing is, as you are going to approach that age, you have to be even more physically active than you were before. Why? Because what happens is, as we are approaching that age, your hormones are now going to dip. Right?
Yes.
That is because that is the natural cycle. Our ovaries stop producing the natural amount of hormones, and that is why, because it becomes lagged in our body, what happens is all the systems are interlinked. It will reduce the reproductive system working. Then it would reduce the digestive system working, and that is why some people, they tend to gain weight, they